Hello, everyone, and welcome to RevMD Sex Bites podcast with me, your host, Dr. Deborah Durst. So I launched Revitalize MD in 2017 on a mission to provide patients with comprehensive ways to look, feel, and function better, ways that traditional medicine just did not offer. And what I found was a whole nother realm of medicine, sexual wellness. It just didn't exist. And as I learned more, I realized that there's so many solutions to problems that both men and women have that we don't learn in traditional medicine, and traditional doctors don't offer it. So my mission with the Sex Bites podcast is to bring that information to you. So please like, subscribe, and add anything you might want to talk about in the future. But for today, we're going to talk about women and sex in a very candid, open conversation. And I have Michelle Silva with me today. She is a news personality and hosts a morning show and is an awesome interviewer. And again, doesn't know much about what we're about to talk about. So you're going to get a very natural flow of information and questions, and trust me, she'll ask all the things you're thinking and probably even more. And she's going to take over at this point, not only introduce herself, but she'll take over and she'll be the one interviewing and asking questions. So Michelle, do you want to introduce yourself?
Yes. Well, thank you so much for having me on Sex Bites.
Thank you for coming.
What a fun name, first of all. And and Deborah, ever since we first met, there's been a lot of interest. Something people don't talk about, or especially women, or it's hard to talk about, or how do you hear about it? And it's very interesting. It's an interesting topic, and you can only read so much in your Cosmo magazine. And
yes, when there's not a lot of places to get the information, right?
Absolutely.
And so I think even Cosmo starts to touch on it, but I don't even know that they get into the depth that we're going to get into. So
exactly, you can read so many different magazine articles, and a lot of them end up contradicting each other too, as well.
Too many sources, a rabbit hole, right? You start searching one thing and then you're on to another and another. And so I would love for us to be a source of information that women can at least go to, and men, depending on what topic and that we talk about. And we'll talk about a lot of them. But even today, this is a great time for you to learn a lot about it and ask the questions that all women have and more, I'm sure. And then, just have open conversations about it overall, like women and sex. What might they be experiencing that they want solutions for? So I'm going to leave it up to you. I'm going to let you direct it from this point on.
You want me to start now? Well, I know that my girlfriends, we have our Thursday afternoon get-togethers. And of course, we talk about a little bit of everything, anything from, kids to our jobs, our personal life, and what we experience ourselves. And as women, I guess like I said, where do you get your information? Reading from a magazine or hearing stories? It's not so much that you talk so much about that, other than, met somebody and, talked a little bit about
sharing experiences.
Exactly. Yeah.
And so I'm sure that you find out with that, because again, I do the same thing with friends, that women are more complex than men. I find that to be the case not only in my practice, but with all my friends. We're a little more complex. So when you're having conversations, do all of the women enjoy sex?
That's the thing. And I've been hearing a lot of them don't like it. And it's, okay, is it because they have the kids, or are they too busy, or are they with the wrong partner? And then some of my single friends, well, I think they like it more. and is it because you're single and you're not in that committed, you don't feel like you have that structure of, okay, I got to be home to make supper, I got to take the kids here? And is it like a time thing, or is it your body going through changes?
They're so different individually. And I think we're just so much more complex. I think that women have 98% of sex happens in the brain for women, which is not the case for men, right? They have a very innate drive, and it doesn't really matter what's going on. It's still there. And even after their, testosterone or hormones decline, it's still there. Where it might
You're
not
talking
be for women.
In their teens, 20s, 30s.
Yeah, 40s. It's still there no matter what. And so I think for women, probably in relationships, that connection, because there can be issues in the relationship. Resentment's a huge one. So if they're not feeling listened to, if they're resenting their significant other, then that really interferes with them having a drive, the libido or even arousal, to want to have sex. So that might be, but then you see married couples, and I'm sure you have too, that have a great sex life. Now, I don't think it's always the case that the relationship is an issue, but I'm sure some of our friends, I at least have one or two that, they've been married forever and still having great sex. So, that's when I think, again, there's other things, shame, guilt, family upbringing, there could be, childbirth issues or anatomic issues, but hormones can have a huge impact too, because, again, as our hormones decline, so does that sex drive.
But how do we know it's our hormones?
I mean, women experience different things. So obviously low libido, which is what we're talking about, or sex drive or not enjoying it. There's only a few different things that actually are going to cause that. So if you're not on medications causing it, for the most part, you're probably looking at low testosterone. Have you ever really heard any of your doctors talking about low testosterone for women? Or when you're in your OBGYN doctor, do they ever bring that up or ask about sex drive even?
I haven't really talked about that. 'Cause I feel like when you are at the doctor's, it's like, is that the time to talk about it? Should they bring it up to you? Or should you be asking questions because you feel like you're in there for your certain appointment? Check this out, check that out, get your
specific reasons.
Yes. And then you're in and out because they only have so much time. And you feel, how do you bring up that subject? Because it's timely. Not only timely, it can be time consuming. It's not just a 1 word, 2 word answer.
It's not a couple questions. It's a deeper conversation. But and I think that's it. Like, I've traditionally trained. And so with that, we didn't learn about sex, in med school, and they're still not learning about it today. But yet, a lot of women will have some kind of sexual issue, about half of them, and it increases with menopause. And so to not have that conversation as a primary doctor or as an OBGYN is a huge disservice to, our patients. And so we really should be bringing it up with patients, but we're not taught to do that. And so it's uncomfortable for you to bring it up, to initiate that conversation. And I don't know that I've had many that have really come to me saying they've had that conversation, or at least if they've gotten anywhere as far as a conversation or solution.
Yeah, because it's hard unless you have and I have a really good relationship with my doctor. But like I said, I always feel I'm in there for a sinus infection, or I'm in there for my annuals, or you're in, you go for your mammograms, and it's like, is this time to start asking about, certain changes in your body? Or do you even know that it's happening?
Yeah.
And you don't even realize it. And all of a sudden some years pass, and you might hear other friends talk about how their sex drive is different. And then you start to wonder, what's wrong with me?
And it's kind of funny because my friends and I have always been very open about sex and all of them for the most part. But I don't know that I've ever really had any one of them say that their sex drive wasn't good. And so I hear that more. And of course, now we have those conversations because, this is, what I do, and it's a passion of mine to have those conversations, but most of it was in the office, where women would come in with that. And so women don't talk to their friends frequently about how their sex drive is lower. So, and I don't know about you, but I've never even asked those friends that don't have a huge sex drive whether it's changed, whether they used to and they've noticed a change, or because a lot of women, it's more insidious. So if it happens over time and it's a slow decline, they may not even notice a huge decline, where some of them might not have had a huge sex drive from high school on. So again, not a noticed change, but then some might have an abrupt change. But I don't know that I've ever had anyone bring it up or even find out what the difference is and how acute that change was.
But because how do you talk about that with your friends too? Sometimes that gets a little more intimate, a little more personal.
Well, and it's funny. We'll have those personal conversations otherwise, because women are pretty blunt and pretty open with other things, like, what's going on with sex, like oral sex, whether it's just,
where you did it,
traditional and not oral, or, where you did it. Like, we're pretty open, but it's, and I really didn't even think about it till right this moment, because now I'm having conversations, but I don't think anyone's ever really said, specifically when we're open and talking about sex, that they've had a change and a drive. I mean, it seems like either they don't like it and they don't talk about why, and they just don't talk about it. And actually, I don't have probably too many friends that, aren't open and like it, but we never had that conversation about like drive. So you would almost have to have, and you're not going to have it with family, right? And so where do we have those conversations about a change in your libido or drive?
And how do you know it's happening?
Yeah.
Sometimes maybe, hey, this is how I always was. Maybe some people feel, that's how it's supposed to be.
Yeah.
Maybe it's not.
Exactly. So I think the big thing is when you notice it to be a problem, right? So if you had a drive and now you don't, then it's going to be some sort of medication or it's going to be low testosterone. And for us, when we have patients in the office, I mean, they're having those conversations pretty openly. They're coming to us, and a lot of women are tearful because of problems in the relationship and low sex drive because it really causes issues. And they'll actually be tearful when they're there. And so clearly that's a problem prompting their visit. But most of them have already had visits with the primary doctor or the OBGYN doctor and just haven't had solutions. It's usually one or two questions in, and then they just don't get solutions. So I think it has to be something that you find problematic, something that's a change for you, because look at orgasmic strength, for instance. It's not an obvious, objective, external, body part like it is for men. So when men are having any kind of erectile changes, it's pretty obvious to everyone involved, right?
Oh, yeah.
But yeah, it's very obvious.
But they can just take a little blue pill, or they have a lot more options.
Well, and so there are a lot more options, and even women can take that. We'll do it more in a compounded, we do it in a different way. And those are things we can discuss. But you bring up a huge point, is that we've addressed issues and ways to treat it with men. And they'll even go to a urologist and they have those conversations, and there is a medicine they can prescribe. And even though we can take it as well, you're not going to see that on the news, or in a magazine or from your primary doctor. We do that, but again, it's more of a non-traditional path where we're comprehensively treating some sexual issues in men or women. But for men, it's pretty obvious that they're not having the erectile function that they used to have. Everyone notices, but with women, only And so if you're having those conversations or you're seeking a solution because you were having great orgasms and now, you're 50 or 52 and you're not noticing, it takes you longer, or sometimes you don't even. And nobody's going to know that but us, because we don't have any way for somebody else to look at us and know. And women are pretty good at faking it, right?
Oh, yeah.
Yeah. Yeah.
But what are some signs, I guess, when you know, or how would you know that you have low sex drive, low libido?
I think for anybody to almost establish a norm for them, because some people I think might never have really had a high sex drive. And so it might have been high school and they've never really been, that kind of sex driven woman. And then for others, they have been, and now they notice a decline. The issue is that when it becomes a problem for you, and sex is a natural part of, a relationship, of joy of life. And so if it's becoming an issue with the quality of your life, then you definitely need to have it addressed. And so if you have no desire for sex, but you used to, or if you used to have great orgasms and you're not, those are issues that need to be addressed for sure. And there's so many different things we can do about that to help
before
women.
we go on to that one, because that reminds me, I think like the women in my family, as they got older or with some divorces and so forth, women were like, oh, we're fine. Never really even considered dating again, and was fine with doing, just shopping and, girls, and not ever having that type of relationship again. I think that was kind of weird.
Well, and I think that, again, it was never acceptable for people to talk about it. Women. Men, again, there's low T clinics, places, the urologist or primary doctors will have conversations. There's options for them. and there's no one having those conversations. There's no options. There's no approved medicines that are, going to help women. And so people aren't having those conversations. It's not like our mother had it with us, where they would say, again, you're going to hit, menopause or perimenopause, and your orgasmic strength might decline. It might take you longer. That's not normal. Honey, those are things they'll talk to us about periods that, we're going to have in the future. So again, I think women historically have kind of put everyone else first, right? And we haven't considered ourselves enough. We're used to taking care of other people, and then it wasn't so objective. And if they didn't have orgasms, they thought, well, that's normal. It's okay. It's part of life. I'm going to accept it. And men will never accept that, right? And so now there's
they watch porn.
They can do. Exactly, which makes it easier for them. And again, so I think that drive is very straightforward. Again, what they kind of do with that can be straightforward too. Where women, it's like it's in our head. We have to connect. And if a relationship's bad, that's not good. If we're bored in a relationship, that's not good. Keeping that relationship young and healthy and and different is obviously part of it. But again, if your drive is different than it was, then it needs to be addressed. I do, when I'm doing hormonal treatments for women, discuss where they were. Like, is this a clear change for you? Because if I'm going to end up optimizing testosterone, and we'll get to all that, if I'm going to optimize it, I don't want to make them have a sex drive they've never had. But again, then there's other women that have no sex drive, first thing to go, the last thing to come back, and it's medicines or testosterone for the most part. And so you always want to gauge, like, where were they? What were they like in high school? What were they like in college? You never want to give them too much where they're now uncomfortable. So I think if it's a change for a woman, like if it's a change for you orgasmically or drive-wise or arousal, then it needs to be addressed. And there's just lots of solutions that women can have.
I think a lot depends on your partner too. Like the type of attraction you have in that partner is a lot of your sex drive. I believe in that. But I think as you do get older too, then there are those times where everything else comes into play, where you think everything else comes into play. So what can I be doing though, to say, while I'm at home, and is it something that I can eat or do differently for anybody listening out there?
So I think, like, if you're noticing a difference, period, and how you feel, energy wise, brain fog, sex drive, orgasmic strength, any of that, weight changes, all of that. I think always a healthy eating, lowering sugar, sleeping, managing stress, all those are important. Those are little things that women can do at home. And we're still having those conversations, even if we're doing other stuff with them. And so those are things they can definitely, and medications, again, medications is a huge thing. So if somebody's on medications such as, birth control, for instance, that'll drive down testosterone levels, just free testosterone levels. So it actually increases a binding protein. And so they have acne indications. And so they purposely drive the free testosterone down. So that's one that can decrease your sex drive. High blood pressure medicines, antidepressants, anti-anxiety. So definitely if you're on those kind of things, maybe, finding a provider that's right for you that can look at hormones. Maybe it's a hormonal decline that you're experiencing, and not that you actually need antidepressants or anti-anxiety or sleep medicine, because all those can interfere.
How do you get your hormones? What's the easiest way to get your hormones tested?
And so I think a lot of women come to us for that. And most of them have been on Google, and I say this is one area of medicine where patients are actually more proactive than providers. So if you go to your primary doctor, you'll ask, the right questions. I'm tired. I don't feel well. I'm gaining weight. And frequently you'll hear, everything looks normal, even when they do traditional testing. And some of them will hormonally test. It's not always treated right. So a lot of women will end up in front of me. So I think, again, from an overall standpoint, finding someone that does hormone replacement therapy or bioidentical hormone replacement therapy or pellets, in your area is probably the best way. Finding somebody that specializes in hormones that can actually test appropriately and then treat, to the level that you want to be treated. We want to optimize. So traditional medicine does a lot of normal, so they'll give you a range of blood tests. And if you're within the normal range, then everything looks normal. That's why you always get that result. And so instead we want optimal. And so hormone replacement specialists are really the providers you want to go to get those hormones replaced and checked appropriately. And so finding the right fit for you and the area. So Googling is how most patients end up in front of me, honestly. And I always ask them what they're looking for. Was it hormones? Some of them will be pellets. One lady actually said, I said, what do you Google for? Because I always talk to our website guys and make sure that, if it's something that we're not covering enough, I don't want them to search too hard to find that provider. But one of them said, I think I actually honestly just put in, I don't want to feel like crap anymore.
Wow.
And typed in, the question.
I would think they might say something like, why am I not horny? Or why did I not get aroused around my partner?
Well, honestly, people are typing in questions now, right? It's not just they know what the solution is. Like they'll type in a question. And so that's a common Google search. And I've never had anyone say that, but it wouldn't surprise me if that's the case.
I've heard it. I've heard it around town.
Yes. I've been in the bathroom.
I think that's one of the, one of the more simplest terms, I would think.
Yeah. Yeah. Why am I not turned on? Why am I not having orgasms anymore? Yeah, absolutely. I just have not heard anyone, or maybe they just haven't been transparent with me.
There you go.
About what they were searching for.
And at what age though should people be considering going to the next level, or even, searching for answers and thinking that there might be a problem?
It varies quite a bit, but 45 to 55, I typically say, is a perimenopause state where your estrogen will sometimes be high. That's again, if you're not on any medicines that's interfering, like birth control or had surgery, if people have their ovaries and their uterus removed, then it'll happen earlier. And then likewise, we're exposed to so much toxicity now that we don't make hormones the way we used to. So we see it into the 30s sometimes. And some of those 30-year-olds with no sex drive or no energy will actually be on birth control, which also, again, drives down that testosterone. And so they'll be experiencing symptoms earlier. But 45 to 55 is typically that perimenopause. So our testosterone, progesterone start to drop. So we might have sleep issues. We don't handle stress the same way. We get, set off at nothing. So we get upset over things we would not have gotten upset over before. And then when testosterone declines during that time frame, then again, it's brain fog, energy, low libido, weight changes. I'm doing the same thing I've always done, but now I'm gaining weight. And, those body composition changes. If you sat women around the room, honestly, they all will nod and say, that's me, that's right, because a lot of them are experiencing the same thing. Again, if it's a more insidious decline, maybe not, as abruptly. So 45 to 55, and then after that, it's menopause. And so when that hits, that's when your estrogen starts to drop. You don't have periods anymore. And or that can happen earlier as well if they've had surgical menopause and everything removed. So any time frame, really anytime you're experiencing a low libido, energy, brain fog, you're on medicines, you probably should be tested even if it's early. Otherwise, in between 45 and 55 is that prime time for our hormones are all over the place. So we're not sleeping, we're anxious, we're a mess during that time frame because it's a no man's land. We have hormones that are declining, some are in excess, and so that's the time to be tested.
And does it matter or differ women who have had children to women who have not had children?
I think that childbirth, and is a pretty common time for people to see a hormonal decline, especially after a few, because there's such a change and fluctuation that some don't recover from that change, not all. And then if you've had tubal ligations or tubes tied, to prevent pregnancy, even though we don't think that affects blood flow, it does have a vessel cut to cut the tube sometimes, and so anytime we're making an incision of any sort, I say you could affect blood flow and hormonal decline. And a lot of women will say they've noticed changes after they've had their tubes tied, even though they haven't had their ovaries removed. That's another time, because childbirth, again, I mean, we're all over the place our entire life because we've had hormones that are fluctuating so that we can procreate. And so then again, it starts to fluctuate even more with pregnancy. And then when we start to decline, we still have some fluctuations until we hit menopause. So again, I think we are always only a little more difficult to figure out because we have so many hormones that are in flux. And then with menopause and perimenopause, it gets even more
complicated.
That's right. Absolutely.
And then what can we do? You talked a little bit about the pellets and hormone replacement therapy, but what does that all entail?
So typically when you're doing it, like you'll come in. So say you were experiencing, brain fog, like say low libido, because that's actually a very common one. And it's the first thing to go, the last thing to come back. So a lot of women will come in because the relationship is taking a hit just from no sex drive or arousal. And so we'll have a conversation about their medical, history, seeing what their meds are, what their surgeries are, what kind of symptoms they're having. And we actually ask a lot of sexual questions, how's your drive? How was your drive? How's your arousal? Do you have pain? Do you have dryness? There's a whole bunch of questions we ask, opening up that conversation, not just about hormones, but also about sexual function. And then, the issues, you need to find somebody that you feel comfortable with, but then you need a hormone panel checked so we can kind of see where you are and sit down and talk numbers.
What's a hormone panel check?
A hormone panel. Yeah. So that's like so we'll draw your blood. And really that's where the hormone specialist comes into play. So if you're not in front of the right person, you still may get that normal or not the right test done. But when we're doing a hormone panel, there's lots of hormones in women. We're looking at testosterone, progesterone, estrogen, cortisol. You can look at prolactin, oxytocin, thyroid. There's lots of different hormones we can look at. But one of the biggest hormones that goes unaddressed with women is testosterone, which is a lot of what we've talked about so far with drive, a little bit of arousal, but drive for sure. And there's low T clinics for men.
You mostly hear testosterone in men together. You don't usually hear it when you talk about women.
Yeah, you don't hear it much at all, do you? And so that's the issue. It's the most abundant circulating hormone in a woman's body too. And again, I think those women that have sex drive, that one woman might have a huge sex drive, and then the friend next to her doesn't have any. And this could be in their 20s, 30s, or later. I think some women sit naturally higher in a testosterone level, than some women. And so again, you want to make sure what their normal is and what their comfort level is before you take it to a certain level. But testosterone is the most abundant circulating hormone in a woman's body. And so when that starts to decline, we notice, and energy, brain fog, libido, again, orgasmic strength. And so we need to optimize that in women too. And so even though there's low T clinics for men, we go completely unaddressed. There's a gender bias for sure with testosterone in women.
How can we get more testosterone in our bodies? Is it things we eat?
I think, again, being a physician that really specializes in hormone, there's lots of nutritionists that will talk to you about different, supplements. I think, again, eating healthy, sleeping, lowering stress. But the best way to get testosterone when it lowers is to get testosterone in some way. So when we do levels and we check blood work, then we can actually sit down, talk about your numbers, and even a range is a laboratory range, right? There is no normal range for women, really, because we don't have any treatments approved for women with testosterone. Nobody's looking at it. There's a huge gender bias when it comes to women and testosterone. And so if you look at major traditional societies, they don't have recommendations that are good because they're not actually treating patients that have low testosterone. And if you talk to women that are optimized with testosterone, they feel fabulous. It's life-changing, more life-changing than almost anything else we can do. And so you have to get those numbers, see where they are, and see somebody that is willing to optimize you to get you feeling better. And you can do that in lots of different ways. There's creams, injectables, pellets, and again, I love the pellets just because it's a simple incision, simple procedure, but then, your level's going to go up and stay up. And so it's a more consistent, so you're not going to get any fluctuations. And again, we've had enough fluctuations of hormones in our life. I don't want to cause those fluctuations once they come to me. So
there's nothing like a supplement that we could be taking on a daily basis.
No, not really. Again, I just think healthy eating, we have like a libido stem supplement, which has a lot of different supplements in it, probably about 10. And so even if we have like a binding protein that goes up with birth control that drives the free testosterone down, it's hard to get that binding protein to go down. But like, Tomcat Alley, like weird names in the supplements, but there's like 10 of them in there that can help with, and carnitine, taurine. But are you really going to get a boost in your testosterone level? No. The best way to do that is to have them checked where you have a normal range and you have a normal level for you baseline. And then we have some goal that we're shooting for. And typically when I'm doing hormone replacement or optimization period, I have a goal level I'm shooting for. And then I have symptom control. And I go over that with women when they come in. When we sit down and talk about blood work, we're talking about this is the level we're reaching that we want to reach. But these are the symptoms we're trying to control. So if we can get those symptoms under control at a lower level, that's okay. As long as and their hormones are protective too for bone, brain, heart, all of that. So something good to be on. And again, for another segment, there's some, there's a lot of myths about hormone replacement. Testosterone is one of them just because we don't do it with women, right? And then estrogen or progesterone, testosterone causing cancer, that's not the case. But it can cause an issue if somebody has breast cancer that's there and can cause growth. And so we need screening mammograms, but it is a huge misunderstood area of medicine. And so again, going to somebody that specializes that can explain that to you is very helpful.
Like Revitalize MD and Miss Deborah.
That's right. Getting everything done and just checking out, levels to see, where you are with it. So, and then even like orgasmic stuff. If you're talking about that, you're talking about a whole nother level of sexual wellness. We've talked about hormones and drive, but there's ways to improve orgasmic strength with other things that we do locally.
Really?
To treat it.
Mm-hmm. So this takes care of it all.
Yeah, no, you can comprehensively do it. So we've done a lot of talking about hormone replacement and drive, and we can start talking even a little bit more about arousal or orgasmic strength. So women, again, with sex, it can be a drive issue. It can be an arousal issue. It can be an orgasmic issue, and it can be even pain, and there's some conditions that cause that. But there's lots of local treatments that we can do that improve arousal and orgasmic. And so like the O-Shot, have you ever heard of the O-Shot?
I've never heard of the O-Shot. No. Okay. What is the O-Shot?
All right. Well, so the O-Shot is one of the things that we do for local regeneration. And so again, if somebody's having trouble with arousal, and that's more of a blood flow issue. And so increasing blood flow, the O-Shot does that. Orgasmic strength, again, the O-Shot will increase nerve sensitivity and regrowth of nerve. And, urinary incontinence is in there. So the O-Shot, what we do, have you ever heard of PRP?
No.
All right.
PRP.
All right.
What is
so
that?
Some new terms. So we're drawing blood. So with PRP, we actually draw blood and spin it down, and we get what's called platelet-rich plasma, which is PRP. So platelets have growth factors in them. And so then we re-inject growth factors into areas to increase nerve and blood flow. So increase sensitivity, arousal, blood flow, lubrication, and collagen and elastin just to help with urethral support and urinary incontinence. And we actually inject that PRP during the O-Shot into the clitoris and actually the G-spot. Both of those.
Shot.
Just shot. And each one, yeah.
Does it hurt?
Well, and that's the next question, because a lot of women are very hesitant because you're talking about a needle into areas that are not usually injected, right? And so the clitoris is one, and then it actually is the anterior vaginal wall, but we end up going right through the G-spot. And, that shot was developed for urinary incontinence by Dr. Runnels. And what happened is with urinary incontinence, we're injecting in there to get collagen elastin stimulation in an area that's kind of been obliterated by childbirth and the weight of childbirth that is no longer supporting the urethra. But as a positive benefit to the O shot. They ended up getting increased orgasmic strength because it'll increase nerve and blood flow, but it doesn't hurt. Again, it's hard for women to really believe that until they've had it done, even though, we're very reassuring beforehand, but we'll talk them through the process when they come in. But we draw blood, we start processing. Frequently, we're doing a vaginal treatment with it, with a laser called vaginal rejuvenation. And we have a couple different devices that do it. So, the nurses or providers will do that. And then we're doing the O shot after. So we've placed some numbing medicine after the laser. We'll do a block that, helps prevent any people from feeling anything. And we actually, have it down. I've been doing it for long enough now that we have it down where most women don't feel anything. If anything, maybe a 1. Ice actually gets a little more uncomfortable than anything. I feel it's like a kind of just, awkward pain, ache that you get just with ice, but very comfortable procedure.
And what types of, how many office visits are we talking about within this process? So
when we're talking about local regeneration, and that's what I call it. So we're almost doing hormones, but when somebody comes to us talking about hormones, we're talking to them about sex too. And that's why a lot of those questions are actually asking not only about the hormone symptoms they might have, but at the very bottom of that, we're talking about, orgasmic strength. Have you had clitoral versus vaginal? Do you have incontinence? Do you feel like you have laxity? And, drive. So to ask a lot of sexual, wellness questions. So that kind of guides what we do. And so it depends on what somebody's coming. I have young ladies that have not had any deliveries or vaginal births or any pregnancies and just want increased orgasmic strength, or have never had a vaginal orgasm and would like to have that. And then we have women that have had 3 pregnancies and 3 vaginal deliveries. So they have laxity, they have urinary incontinence, they're jumping on the trampoline, and, they're having leakage. And so that might require a little bit more. The only time I ever really recommend a no shot by itself is if they're young, there's no laxity issues, and yet they just want increased orgasmic strength, because we definitely don't want to heat the canal with a vaginal laser and make it tighter if it's already tight and they're young and healthy. But otherwise, you pair the O shot and the vaginal laser together, and usually you're doing at least 1 O shot and 3 vaginal treatments with the laser, and those will usually improve most urinary incontinence, again, orgasmic strength and tightening, and occasionally people will need more than that depending on the severity.
But are you getting results right away too, or like how soon?
The weird thing about the O shot and the Votiva is one of our lasers. We actually have 2, but so I'll say if I'm doing the laser and I'm doing the O shot, to me it doesn't make sense that you're going to get improvement right away because we're regenerating. So we're using your blood that has growth factors to communicate with stem cells in an area to regrow tissue, nerve, blood flow, collagen, elastin. And so it's not like we're giving a drug and then you're suddenly going to get pain relief. Like you have pain, we give pain medicine, you get pain relief. Instead, what we have is your body's going to start to repair itself, and we're giving it what it needs to repair itself. So typically I always say 3 weeks to 3 months with that. It's going to take a little bit more time, but it's bizarre that a lot of women will actually get immediate relief of urinary incontinence with just 1 O shot with the pairing with the laser. And we'll pair the laser just because, again, usually they have symptoms of laxity, and if they have incontinence or decreased orgasmic strength, it really is going to tell that tissue it's injured, and then we're dumping a bunch of growth factors in there. And so we do the O shot with the laser the first time. And when we do that, a lot of women will get improvement immediately, which to me doesn't make sense scientifically but I don't know if that tissue in there just keeps it, keeps the fluid in there. But a lot of women, I don't set that expectation, but a lot of women immediately. But if not, again, we're repeating that laser a month out and then another month out, usually for 3 treatments, and it's all cumulative. So if they don't get it immediately, usually by the 3rd, they're there. And there's an occasional woman that might need another O shot or, laser treatment, just depending on the severity or lack of response to, but there's really not a woman that we can't get improvement in those areas of incontinence. It just depends on how many it takes, but a lot of them immediately. Surprisingly, long answer to your question.
And I'm going to walk out of there feeling, is there any downtime? Am I going to walk out of there feeling like I've been riding a horse or something?
No. So like there's no downtime, no pain, which was the other question, like not, most women are very comfortable, we're heating. So the big issue is the O-shot, no. Obviously, anytime we put a needle on anything, you potentially could get bruising or swelling and have some. But for the most part, women do not. And in fact, most women might feel engorged that night. And so actually want to have sex and, and be aroused by it. And so, and then the lasers we're doing are just heating and non-ablative. So they're not causing any injury or taking tissue off. So you don't have downtime for that too. And most women are quite comfortable right after, and can go back to work, can go back to normal activity, all of that.
Yeah. Now, is this something that they would have to keep up for the rest of their life?
I almost look at anything that we're doing, no matter what we do in life, right, is that there's some maintenance. So once we get you to where you want to go, usually once a year, somebody is repeating like at least an O-shot and a laser treatment. Some women, again, I've had women that have not had vaginal orgasmic experiences ever, or at least what, they term to be vaginal orgasms. And so they may want more, just to try and get that. And again, it's a cumulative effect. It's no guarantee, but you don't know how somebody's going to respond, but it's the only chance you have of trying to get an orgasmic, a vaginal orgasm. And if you've never had one, so.
And are there any people that would not qualify for the rejuvenation and the O-shot?
Again, you're using PRP and the other one is just heating and not ablating. I always want somebody to make an informed decision, what they're comfortable doing. So I will provide information. And again, there's a whole list of potential complications with the O-shot, but for the most part, you're using PRP and it's your own blood that we're drawing and injecting. So PRP is fabulous. We can do it in the face and hair. We do it for men with the P-shot. And so we do it everywhere because of the growth factors and the response you can have. So for the most part, you're not going to have any issues. And I would go as far as to say there's not really any reported adverse effects to PRP. But again, if we're doing a needle and injecting, you could potentially have some things, like seroma, bruising, swelling, that kind of stuff. But for the most part, anybody can get an O-shot. In fact, breast cancer patients that can't have hormones because they have breast cancer, but a lot of them have pain and dryness, can actually get an O-shot with improvement because it's increasing blood flow. And so they can increase lubrication and therefore pain. And then again, the Votiva, if anybody's too tight, if they have vaginismus, so that they have some kind of muscular issue going on, you have to do a vaginal exam. So I would do a vaginal exam just to make sure that everything looks good. There's no pre-existing, if there was any kind of, vulvar cancers or, cervical, then we wouldn't do it. So there are occasional when we're ever using that heating device that could cause issues. But the O-shot is, pretty much open for anyone, even if they've never had vaginal deliveries. And even if they're breast cancer and want some improvement but can't have hormones. So.
It sounds like, or seems like you get a lot of positive response.
Women love the O-shot. And I, again, love the response of the laser with the O-shot because the laser, is really just telling tissue it's injured and then you're putting a bunch of growth factors in. So to me, they pair so well together and women love them. Speaking of which, even it's very common for women to have breast surgery, and implants. It's a very common surgery now. You can actually put PRP. So as part of the O-shot, we'll frequently have that discussion with patients to see if they want PRP under the nipples. So if they have decreased sensation with a previous breast surgery or implant, we can put PRP under the nipples with a great improvement in nipple sensitivity.
You have a lot of patients for that?
We actually have
I've never heard of that one either.
We actually have a lot of patients with that. Like a lot of women will do that. Some women will come back and just want even just another nipple repeat of PRP. So it's very common. Women love the nipple PRP as well.
I'm just blown away.
Lots of
everything that is available out there. And we're not talking surgical. We're not talking going under and having hospital stays and cutting and.
No. And I mean, I think that anytime we cut, I'm traditionally trained. So I learned medicines and I learned surgery. And I think though, anytime we cut, we could potentially interfere with function. So if we can get improvement or solutions without cutting, it's by and away the way to go. And again, a lot of what we're talking about, you can't improve. Like I can't improve nipple sensitivity without with the surgery. There's no surgery you can do to improve nipple sensitivity. So if somebody has a breast implant, it's very common that people will have decreased sensitivity. Some will get it back, but not all. There's no way to do that. Again, orgasmic strength, no surgery that improves that. Vaginal laxity, no improvement. There's labiaplasties if you have excess or redundant tissue on the outside, on the labia, but not anything that can make your vaginal canal tighter. You do have some urinary incontinence surgeries, but again, they're not guaranteed. It's downtime, you're cutting, can interfere with function. And this can do it all, and your body does it. So we're really just giving your body back what it needs. The body's amazing. It can heal itself if we just give it what it needs to do that. And so I think that we'll see a change in medicine, hopefully, where it progresses to the point where this becomes more, common and
more widely known.
Yeah, more widely known, more commonly, treated and talked about. But again, in the greater than decade that I've been learning about anti-aging hormone replacement, I haven't seen much in the way of change for hormone optimization. And I think a lot of times if there are medications that are approved or there's pharmaceutical companies, promoting it, then you do get more education and public education and awareness. But without that, I'm not sure we'll see a change. I'm hopeful, but not completely sure about that.
Well, people can just contact you, try to get a little more information, come in for a one-on-one consult.
Yeah, so usually we'll just have you come into the office. And again, our office is text or a phone call capable. So that business line, when you're not a patient, you can text or call and come in and then get in for a consultation where we go over everything with you. And again, I think the most important thing is finding a provider that's a fit for the patient and, in somebody that really wants to have solutions and get better, and finding that provider. We see a lot of patients from out of town. So it's not like completely unheard of that people don't come into town, to get treatments. And again, it's not offered widely yet. And so big cities, but even then, I'm not sure that there's always, just a real comfortable solution. And so just opening up those conversations and letting women feel comfortable and safe in having those conversations. And then we do it pretty comprehensively. So if somebody comes to me for hormones, we're talking about the sexual part of it. If somebody comes to me with like urinary incontinence or decreased orgasmic strength, we're talking about hormones, because you have to be hormonally optimized, and that cell health has to be optimized for you to get sustained results, even if we do the treatments locally and regenerate. So they all work together. And then we do IV therapy with amino acids that help with sexual, dysfunction. And so, drive, and a lot of men and women love that. There's peptides you can use. Like, it's a wide open field. Cialis, like we talked about, the little blue pill for men. Women can use that too, and it's usually compounded. We can compound it with, oxytocin, where that's the cuddling hormone. And so some women might not like to cuddle, and it's, and so they can get—
There's medicine for that?
There's like all, yeah. You can actually get, a little compounded little blue pill. I don't know that it's blue, but a little compounded medicine that has those in combination, those alone. There's peptides you can inject for women or men that want better orgasms. Just already have good orgasms, but want more intense orgasms. There's peptides we can use and prescribe for that. So there's all kinds. We have GainsWave that we do for men. We can do it for women too. The other laser that we had does just clitoral treatment. So you can actually use the laser over the clitoris. And again, the clitoris, we only see a little part of it, right? And so as our hormones decline, that clitoris actually gets smaller in size. You don't see as much of it. But that's only one part, and it's the equivalent of a male penis on a woman. And so, but there's parts, like what I consider legs that go down on both sides of the vaginal canal. And so that's where I think that even though women might not think they have a vaginal orgasm, I don't know that women that say they have a vaginal orgasm have strictly a vaginal, because there's the clitoris that comes down on both sides. And so, we can do a laser treatment that basically is going right to the clitoris and those legs that come down on both sides. And that does a great job of stimulating stem cells to the area and growing. So growing nerves and blood flow and collagen elastin, but so increases orgasmic strength. And that's not something I would do alone because it's just the clitoris, but it's always an adjunct we can do to the other treatments. So there's like the sky's the limit and what you can at least have a conversation about and explore options. And even if people are having pain, there's all kinds of, like, even if you're talking about using dilators or intravaginal Valium, there's just not a lot of option, that people just don't know that there's a lot of solutions there. So I think just making an appointment with somebody you can get into, whether it's local, finding a fit for you, and discussing and open those conversations.
Improve your sex life today.
Improve your sex life today. Have the conversations and prove it, right? I think women should talk more about it.
Absolutely.
And know that there's solutions for them. And even if other people can't see, what we're struggling with, if you are distressed by it, then you need to have those conversations with somebody. So, and again, we'll see people from out of town too. So, but any other questions you can think of? If you were coming into the office, anything else you can think of?
Where's the wine?
Exactly. To open this conversation, I need a glass of wine. Yeah, no, absolutely. Well, next time we'll just have to have a glass of wine and talk about it, right?
Definitely.
All right.
Maybe I might have to do it.
Yeah. No, well, you definitely need to try. We need to bring you in. And we need to do all the procedures so that you can actually then know they're not painful, can talk about your experience with them. And then again, get the message out to women so that they know about the procedures after you've had them done too.
Oh, yes. You wouldn't want to be kept away from any secrets in life, would you?
No, you can't be holding those secrets in after. You can't, now that you can't take it back, right?
Right.
You can't pull it back as if you didn't know. So now those options are there. So now you need to come in and have them done and then let others know what your experience is, good or bad.
It just sounds like there's a whole nother world out there that we have not been exposed to.
No, it is. And I think it's sad that even from the testosterone, even our initial conversation, that people just don't have. There's such a gender bias in what we talk about with, just improvement and functional improvement and how we feel better. And I think that, again, men are a little further along with that. I almost probably would say that's because it's more objective. You can see it. And so you're not the only one that knows, so therefore, because somebody else is going to know, you're going to get, improvement, right? But for us, we're the only ones that know. So unless we have those conversations with friends and with our medical providers, or finding somebody that is in that sexual wellness realm that can talk about it all. Open the conversations. Even if it's not over wine, just open the conversations. But yeah, you need to come in and have them all done and then talk about it after.
Sounds good to me.
All right.
I'll bring the wine.
Sounds perfect. Well, thank you, Michelle, for coming today and, again, opening this conversation up so that more women can learn about it. So subscribe, make sure you put any comments in that you might have. Again, anything you might want to hear about. It could be as simple as, the O shot alone. Anything that you want to hear more about, you just let us know. We're willing to deep dive into anything sexual wellness. We're not afraid to talk about anything. And again, we're here to revitalize your look, your health, and your sex life. Thank you.